o'clock, Ms. Wall.
Hi.
Hi, how are you today?
It's so nice to see
Hi,
you
and
again.
who did you bring here with you?
I brought my sister.
Oh, excellent. Nice
to
to meet you. So it's my understanding that we're doing a laparoscopic hysterectomy. Is that correct?
Yeah, I'm a little nervous.
All right, don't worry. We're going to get you through this, okay?
Mm-hmm.
I wanted to talk to you a little bit about your pain control after your hysterectomy, if that's all right.
Yeah.
So, in terms of your pain after this surgery, we do expect that you will have some pain.
Okay.
Our goal is to manage your pain so that you can function, you can eat, sleep, walk, and do light activity.
Okay.
Some women don't require any opioid medication after surgery, and when we say opioids, we're talking about oxycodone, Norco, Oxycontin, all of those things are considered opioids.
Okay.
The reason we're having this whole conversation is because there are risks associated with opioids.
Mm-hmm.
Well, the risk of developing dependence or addiction is low after you use opioids for pain control after a surgery. There is a risk. And that risk is increased if you have a history of depression, anxiety, alcohol abuse, or addiction to other medications.
Okay.
You're also at risk of dependence if you take the opioid medication for longer than a week.
Okay.
And it's important to know that one of the major ways that opioids get into our communities is when leftover pills get into the wrong hands of someone else.
There you go, sis.
Yeah. Usually without even the knowledge of the person to whom they were prescribed. There's also notable side effects of opioids, which include drowsiness, severe sleepiness, confusion, difficulty peeing, difficulty pooping,
Yeah, I don't want that.
nausea, vomiting, or itching.
Okay.
So that being said, we do have a recommended pain control regimen for you.
Okay.
So we recommend that you start with ibuprofen.
Okay.
And you take that around the clock every 6 hours while you're awake.
Okay.
On top of that, you can take Tylenol as needed.
Okay.
You just want to make sure that you don't go over 3 grams per day. So do
Okay.
make sure that you look at the bottle and don't go over that.
Okay.
On top of that, you'll have your opioid to use as needed. It's important to know that as you don't have so much pain, I want you to decrease the amount of opioids that you're using and space out the time interval in between your opioids.
Okay.
Okay? So today, for your vaginal hysterectomy, we're going to be
Okay.
prescribing you oxycodone.
Okay.
We can prescribe you up to 15 tablets of oxycodone following a vaginal hysterectomy.
Okay.
But we found that the average patient only uses 7 oxycodone pills.
Okay.
So of course this leaves you with leftover medication that is of course at risk of getting into the community or into the wrong hands. So with all of this information, I'd like to know from you, on a scale of 0 to 15 tablets, how much you would like me to give you.
Thinking 10 would be like a good in between, just because, I have a little issue with pain, and so I'm just a little concerned about that. So do you think 10 would be
I think
reasonable?
that's reasonable.
That sounds great, and I do want you to know, if you feel like you need more, you can certainly call us.
Okay.
And we can certainly give you a supplemental prescription if you need that.
Okay.
Okay, that doesn't require you to come in to get a prescription. We can send it to your pharmacy.
Okay. And if I do have any, have any leftover medications that I don't use all the time, what should I do with that medication?
Excellent question, Ms. Wall. So we do have a map that will be a link to a map on your discharge paperwork.
Okay.
That tells you the specific places where you can return your opioids, which is our #1 recommended way of disposing of your opioids. That being said, we do understand you've just had a surgery, you got things to do.
Okay.
So the secondary way that you can do it is just take those pills, mix them in a bag with kitty litter, like a Ziploc bag, and then just throw it in the trash.
Oh, okay.
Okay.
I know that.
Great. Any other questions I can help answer?
No, that's it.
All right.
Thanks so
Well,
much.
we'll see you soon.
All right. See ya.
Nice meeting you.